Community health is the foundation of primary health care. In many settings, community health workers, or CHWs, are essential in enhancing access to health and other social services. They can also increase the trust, demand, and use of such services among people within their communities. In addition to filling a critical gap in the health workforce, CHWs also bring high-quality and affordable services closer to where people live. Despite the many benefits of CHWs, without proper planning and sustained funding, community health services often face operational challenges. For example, when financial resources are not available, community health programs can experience stockouts of life-saving medicines and supplies, delays in the payment of salaries, and cuts to much-needed training, management, and supervision. These constraints can lead to poor morale for CHWs, reduced quality of services, or even a discontinuation of services in communities where access to healthcare is most limited. Recognizing the need for improving the long-term planning of community health services, UNICEF, in partnership with the US-based nonprofit Management Sciences for Health, developed the Community Health Planning and Costing Tool. Initially developed in 2016, the tool was revised in 2020 based on extensive user feedback and is now available in both English and French. This short introductory video provides an overview of how the tool has and can be used. It also highlights a number of its new features, as well as available resources to guide future users. The Community Health Planning and Costing Tool is aimed at supporting policy and decision makers in the design, planning, and evaluation of comprehensive community health programs. Based on inputs provided by the user, the tool calculates key results on the costs and required financing for introducing, maintaining, and expanding community health programs. The tool can be tailored for either national or subnational programs and can project future costs for up to 5 years. These results can then be used to retroactively evaluate program performance, plan for future programming, and guide decision-making about resource allocation, as well as develop investment cases which can be used to advocate for future funding. The approach for costing community health services and using the tool is further described in the corresponding user handbook, which is available from both UNICEF and MSH. It follows 5 basic steps. First, to define the objectives and scope of the analysis. Second, to determine the data collection needs. Third, to plan for the data collection. Fourth, to collect the data. And lastly, to produce the cost results. It is recommended that this process be led by someone with a broad understanding of community health and health financing, with support from individuals with experience and skills in Microsoft Excel, costing, epidemiology, and public health. Based on user feedback, the revised version of the tool now includes a number of new useful features to simplify this process. These include preloaded global standard treatment guidelines to reduce data collection, integration of the user guide directly into the Excel tool to help users navigate data entry, the ability to add different cadres of CHWs and supervisors, and a user handbook which is available in French and English. This spreadsheet-based tool includes a main menu for quick navigation to each worksheet requiring data entry by the user, as well as links to the key results of the analysis. Users may select a preloaded list of services and related standard treatment guidelines, or they may enter their own. The preloaded package can be added to or modified by the user. By default, all of the Excel formulas and worksheets in the tool are protected. If the user wishes to make any changes outside of the designated cells, or view any of the hidden worksheets displaying the intermediate results of the analysis, the user will simply select Unprotect. To assist the user in entering the required data, the tool now includes an embedded data entry guide providing detailed step-by-step instructions for how data should be entered. All blue cells require data entry by the user, while all white cells automatically calculate and require no entry by the user. For this analysis, using data from Malawi, the user will enter data on the key components of the community health program as indicated by the green colored tabs. For example, in the Program Data tab, the user will enter basic information on the country and baseline year of analysis, the national currency and exchange rate, as well as information on the target population of the program in the selected example district or subnational area. To model the projected expansion of a community health program, the user would simply select Yes for scale-up and No to assume that the same number of districts, sub-districts, and communities will be covered by the program throughout the years. Here we have specified the categories of services delivered through the community health program. These range from reproductive health and family planning to nutrition and immunization. The dynamic nature of this tool allows the user to modify key variables and components of the community health program and in real time identify the corresponding impact on the costs of the program. This is particularly useful for the planning stages of a community health program. For example, in the Coverage tab, the user can input the actual number of health services delivered in the baseline year, as well as the expected number of health services delivered in future years of the program. This can be done by either automatically increasing the number of services by a specified annual percent, or by manually entering the number of services delivered. The dynamic nature of the tool can also be demonstrated in the Training tab, where the user can modify the number and types of trainings that community health workers will receive. After inputting the necessary data, the user is able to display the results of the analysis, which are presented in both tabular and graphic format, and can be viewed in either US dollars or in local currency. In the Summary Tables worksheet, the user can find a detailed breakdown of the results, including a summary of the population reached, the number of community health workers supporting the program, as well as the numbers of community health services delivered each year. The user can also identify key results on the costs and financing of the program. The total costs of the program can be displayed by input, allowing the user to identify the key cost drivers of the program. The user can also identify the recurrent and startup costs of the program, as well as the cost per capita and cost per community health worker. Another useful feature of the results section is its financing element. For example, the user can identify the current and future funding commitments of the program, as well as the funding gaps. Such information is particularly useful for planning purposes, as well as for advocating for future funding. These same results can be displayed in graphic format, allowing the user to quickly view a summary of the key results of the analysis. These include the numbers and types of services by year, the number of community health workers, the percentage of CHW's available time used, and the cost per capita and cost per service. There are a number of other complementary resources which can be used in conjunction with the tool for additional analyses. These include the WHO Guideline on Health Policy and System Support to Optimize CHW Programs, the CHW Assessment and Improvement Matrix, Equist, as well as the Live Save tool, which can be used to estimate mortality reductions based on the coverage of certain maternal and child health interventions. Additional information on these resources can be found in the handbook. To request a copy of the Community Health Planning and Costing Tool, we ask that you please write to fintools@msh.org. Also available for download on both the UNICEF and MSH websites are the User Handbook, which describes the process for costing community health programs and packages of services, and numerous country analyses and investment case reports, which demonstrate how the tool has been used for costing national community health programs, for example, in Burkina Faso, South Sudan, Madagascar, among other countries.